Okay, good day everyone. So today we're going to discuss, continuously discuss about the neuroimaging, neuroimaging topics. So we'll focus our discussion today about the intracranial and extracranial neurological abnormalities. So here we're going to view images which contains intracranial, which when you say intracranial, which is this is within the cranium. When you say extra, that is outside the cranium. Okay. So, so what are the abnormalities that need neuroimaging? So you have here head trauma, congenital anomaly, hydrocephalus, cerebral tumor, stroke, infections, and cerebral vessel abnormality. So these are the abnormalities that usually require neuroimaging. So what are the imaging modality that you use? Of course, we already know this. You have your CT scan, conventional X-ray, magnetic resonance imaging, ultrasound. You have your angiography, myelography, and scintigraphy. So these are imaging modalities. But let's focus our attention to the first three, which is the conventional, the CT, magnetic resonance, maybe some of angiography and myelography. So this is the imaging head trauma advantages and disadvantages in using CT scan and MRI. So let's take for example for CT scan. Well, one advantages of using CT scan it is accessible in emergency facilities. It is very fast when you use it in good image detail. It is non-invasive. It can localize lesions, foreign bodies, and body fragments. It is also a multiplanar for reformations. No? In CT angiography, disadvantage in CT angiography. Disadvantage, ionizing radiation. So aside from um, it has so many advantages, it has also disadvantages. In one of these is that it's using radiation. Second, artifacts. So small skull fractures may be missed also. So those are very minor disadvantages. Then we have for magnetic resonance advantages. It has no ionizing radiations. It is non-invasive, superior contrast resolutions, and orthogonal imaging and MR angiography and functional studies. So if you look at the numbers, it's a little bit small, but still it is non-invasive and no ionizing radiation and superior contrast resolution, which means to say if you use contrast, automatically you could view the image very clearly. Disadvantage, well, basically if you have implants, it's contraindicated. Disadvantage. Second, scan time, it is long. Motions artifacts, usually a little movement of the patients would affect the image immediately, and less accessible. It is expensive, and it is very difficult to evaluate bony fractures. So, now let's go to choice of investigation. So if you have a suspected intracranial lesions, so you preferably would use CT scan with or without preliminary X-rays. But if you are uncertain, then you could go to MRI. If you suspect that the blood vessels or the blood flow is affected, then you could use, let's say for example, stroke, then you could use angiography, whether it is a CT scan or an MRI. But if you have a demyelinating disease such as MS, GBS, Parkinson's, Alzheimer's, then it's better to use MRI than you use CT scan. Okay. So here we have few images here that shows images using X-ray. It shows thinning erosions, of the dorsa torsica, dorsum of sella torsica. Okay, this is an example. Okay, yeah, here's the thinning of the skull. Okay, so this is exposed to uh, maybe some abnormalities or maybe some toxics. No? Ang bata. See that? Look at the brain. It's underdeveloped. You can see the suture. The suture, the gyrus and the sulci. Here, there's a tool of hyperdensity. So it might be a calcification. So in plain radiograph, you can look for changes in the skull, no, induced by chronic raised intracranial pressure. So this is one example. No? So makita mo siya dira sa skull. And then number two, you can use localizing the presence of cerebral tumor. So you could see the tumor within the brain, such as magburot na siya, no? Then you evaluate the congenital anomaly of the skull. So examples of congenital anomaly, here is an example. This is a metastatic tumor. Look at that. If you are going to look at the skull, there is a what? Patchy black appearance. So that's meant to say it is there's an osteolysis that is ongoing on the bones or in the skull. So this is an example of that. So this is a tumor, no? And that one, okay? So that's patchy appearance on the skull surface. Or this one, okay? So here, the problem now is in the skull. Although it affects the meninges because of this term, multiple myeloma, the tumor of the meninges, but it's already migrated on the skull. Okay, this is an example wherein your sella torsica is ballooning like dako, no? It might be because of tumor again, or it could be yeah, tumor of pituitary gland. Okay, so we could also find the hydrocephalus. It could be a non-communicating or a communicating. So if it is in the brain, that is considered as non-communicating. When you say non-communicating, it could be exclusive lang siya within the brain, no? Then you have your subarachnoid space, it is communicating. So let's try to look at here. See, you're communicating hydrocephalus, there is a resorption disorders. So the problem is in the resorption of CSF. So the CSF is not resorbed, so what will happen? There is an increase of CSF volume in your cranial and spinal cavity. So in non-communicating hydrocephalus, there is an obstruction of tumor. Okay. So usually in the aqueduct, or in the cerebral aqueduct, that's where the obstruction happen or found. So in communicating hydrocephalus, though you have problem in resorption of the CSF. Well, in non-communicating, there's a fluid accumulations within the brain because of obstruction. So here, in plain X-ray, if it is usually in infant, there would be a dilatation of ventricle. In adult, if there is a dilatation of ventricle, it might be result to in the increase in intracranial pressure and maybe makuyapan ang pasyente, no? So this is an example for pediatric wherein the frontal lines are not fully closed. So you notice there is a diastasis or a gap between the suture. Okay, so as the pressure build up within the brain, this is really fluid. In order to avoid the compression of the brain, the suture would not unite and will continue to expand to accommodate the intracranial pressure that builds up because of communicating or not communicating tumor. So you see, this is an example of buildup of fluid within the brain. So this is the normal ventricle of the brain. So if you have hydrocephalus, so what happens? So this is an example of intracranial that is non-communicating. Oh no, yeah, buildup of fluid now within the brain. So we cannot yet determine if it is non-communicating or communicating. So usually we can only determine it if we view it laterally and we can find an obstruction in cerebral aqueduct. That's the time that you can say that it is uh, communicating type of or non-communicating type of hydrocephalus. Okay, now so makita ninyo dako na kayo yung ventricles, which means to say there is a buildup, but there's an artifact or there's a hyper intense imagery in the center. So it might be a calcification, so it might be nga naagin siya obstruction. No? So expand, so which means to say na build up. So look at also here the normal, you could see the gyrus and the sulci. But here in the patients with hydrocephalus, wala na, no? Nadikit na po ang yang cerebral cortex sa wall, no? Or sa skull. This is a skull window. So we have here some view of patients having hemorrhagic stroke. CT primary investigation is the differentiate hemorrhagic and non-hemorrhagic. It could be a thrombotic or an embolic. Usually, if it is a hemorrhagic, then you could see the lesions, so massive lesions in the brain. Dapat kayo na, no, mag-itom. Isipin hemorrhagic man na, di ba? Di ay pulling sa blood sa surface sa brain. Kaya nagbutong man ang dugo. Ang nagyanan sa dugo, no? But in thrombotic and embolic stroke, usually it appears 48 hours, 24 to 48 hours after the onset. No, makita na siya ninyo dito. In MRI, it would take 72 hours before you could see the thrombotic or the embolic, the thrombus in the embolus, no? Or the area where the glanges, no? Nasa tong area kung nasa sila ni bara. MRI is more sensitive than CT scan. That is usually after 72 hours. But during acute stage, so CT scan is more preferable to use. So this is an example of embolic infarction. Now, so what happened? Yeah, so kani siya, nag-infarct na siya diri. So kaning nga parts of brain is almost dead. So look at the kwan, ventricles. What happened to ventricles? Nawala. So look at the center, the alignment. Naguba. Ha? So kani siya, ano siya ay part ni siya nga wala na oxygen, no? Kaya na may nag-infarct niya. So ang color niya is hypodense. So bago pa na. Kaya kung magdugay, hyperdense ni siya, puti-puti na mag-calcify. So intracranial hemorrhage, high density lesions, no, na hyperdense due to the clot. Intraventricular is ano siya yung mga appearance niya, no? It's hyperdense or hypodense. So usually common nimo tanawon na mga high density lesions is your intracranial, subdural, epidural, and subarachnoid. Ang hypodense ra gyud nimo is your intraventricular. So example na intracerebral hemorrhage. So hyperdense siya, puti. This is within the cerebrum. Sometimes we could misdiagnose this as a tumor, especially kung dugay na. Pero kani bago pa na siya, no? Siguro mga 2 ka semana. So makita nimo. So look at the brain, what happened? Oh, ang iyahang tanawa alignment niya wala na. So na siya compression po, nahiwi nang nawong nidyo. Okay, this is an example of epidural, which means na siya sa taas sa dura. No? So kani hematoma na siya nga nag-form dira. So kay dagko man kayo siya, tanawan niyo ang brain na compress na. Okay, this is an example of subdural hematoma. May image na siya. No? We have here intraventricular hemorrhage, so IVH. Pasabot intraventricular, that is within the ventricles. So makita nimo siya. Look at here, this is the ventricles. So what happens to the appearance of the ventricles? On the other side, it is not yet, no, kani di kayo siya disturbed, but very distorted na yung appearance. Look at that. So na siyang hemorrhage diri sa sulod. Intraventricular hemorrhage. So but kasabot nga nung nagka-hemorrhage dira, it might be because na trauma ang brain. Look at this. Kana yan ito man na siya. So this is a fluid. So it might be na siya, this is a co-injury. Maybe kani siya nag-contract na siya diri sa likod. That's why may accumulation diri sa fluid. This is subarachnoid. Sila lang sa arachnoid. So here we have here in the other side, no, kani, and we have here also. Kani nipikot na siya, oh. Look at this one. So kani, so this is more on in sudoral, no, level. Kaya nag-silhouette man siya. So, intracranial infection. So, in meningoencephalitis, focal cerebritis, tuberculoma. So, ang nindot ani niya nga image nimo. Nindot po siya sa CT scan, nindot po siya tanawon sa MRI. So, imaging brain CT scan with contrast, imaging appearance, number of brain edema, increase. So, matanaw nato na siya, no? Kani, example na. Okay. So, na siya contrast enhancement. Makita? So, kani, muna yung appearance. So, kani nagamay yung mata diri. Tanaw na ito mas. So, nawala na. So, ang pinakadagan niya nga, although na siya iko diri speakas, pero mas grabe ni siya ang diri dapat. Okay, nikipos gud ni siya. No, nawala. So, this is another image, no? Kanay infarct. Kani. So, kung tanaw na ito, lahi ang ihang shades diri kaysa diri. This is an example of abscess. Kasi ring, no? So usually infection siya tungkol sa brain nimo, no? Infected dito. Apart tuberculoma could be also another cause. So kana siya na abscess dito na capsule. Kana ring enhancement. Sometimes tuberculoma also exhibit this appearance. Na ring enhancing lesions or sometimes like parasitic infection, no? It's like mga capsule. So, diri, tumor. No? So, sa tumor, dili nato na siya ma-identify if it is benign or malignant. Okay. So, ato lang tigam na niya sa tumor na siya border. Na siya border. Na ang area po kung na niya affected, na siya dapit, na siya idiwa. So na mas with irregular border. So, first we have intracranial tumor. So, kani intracranial within the cranium. So it could be a meningioma, astrocytoma, neurinoma, dermoid, pituitary tumor, or craniopharyngioma, etc. So this is an example of meningioma, tumor within the meninges. So within the meninges siya tuod, sulod siya sa meninges. Ang problema lang kay gadako siya nga nagadako. So ang brain tissue dito sa ilalim sa meninges yang i-compress mo na siya nahiwi ang utok. So this is an example of astrocytoma. This is an astrocytes. So like border oh. Yan another tumor. Almost na siya report. Na siya. So naa siya dako kay ingon. So this is an example of mga tumor. Here's a blood vessel. Magita ta, no? Na CT angiography or MRI angiography. So sa MRI non-invasive, ang CT minimally invasive. Kay ang sa MRI ipaagi ra man siya sa imuhang ID, no? Ang CT ano siya, no? Intravascular catheter na siya. So this is a cerebral aneurysm. Kita mo, aneurysm kani balon. Another balloon. It's an aneurysm. Kani pa do? Nipis na. This is magnetic resonance angiography. Kana. So this is in your circle of Willis. Kani mas klaro ang circle of Willis diri. So this is a bare with balloon. No? CT scan. So kani sa anterior, middle cerebral. This is the posterior. Kani siya gikan siya dito sa ubos nimo. So may okay. So So this is an example of AV malformation. What is AV? Arteriovenous malformation. So that is an muro nagkumpul-kumpul na siya nga network sa blood vessel. So kani ang ihang appearance ani sa X-ray, it could be murag tumor siya, ano puti-puti. Ano. Pero sa CT scan, with contrast, mo na niya appearance. So kani network of blood vessel na siya nga nagkumpul-kumpul. Sa surface naman na siya ang sa brain, pero kakada pan siya, no? Ano yung appearance? Now, sa surface naman na siya. Just imong subarachnoid. Pero kay tungod dako siya nga network sa blood vessel man makakompress sa brain. Kinahanglan na siya i-clamp. Kana mo ni appearance sa AV malformations. Mag-tumor po siya sa okay, then we have diffuse weighted imaging. So Brownian motion, so usually sa water. So, makita nato na siya anya. So na siya. So that refers to motions of water. No? Ang Brownian motions. Usually, it is a technique used in MRI. No? So, mas nindot kung nai-ischemia, usually in mga ischemic stroke such as your embolism, lacunar, thrombotic. So, mas nindot gamiton ang diffuse weighted imaging o DWI. No? Makita nimo ang extent of injury. Ano lang. Okay, so thank you. I'm going to upload this image in the Google Classroom.